Hi guys. Sorry I haven't posted a video recently. I've been super busy with school. I'm in university, so I've been pretty busy with that. I just wanted, excuse me, sorry. I just wanted to update you on how the ACL recovery is going. So far, it's been going pretty well. Back and forth. I had my stitches removed. Today's Sunday, the 24th, I think. Let me just check and see. Um, it's Sunday, the 26th of April, and I had my surgery on the 22nd. So it's been about 3 weeks. It's about the third week, headed for the fourth. So yeah, my leg's getting better. I'll just show it to you in a few minutes. But I just want to give you a quick recap from the last time I recorded. Um, so last time I was still on crutches, and I was pretty much moving around on crutches full time. Now I'm kind of off my crutches in the house. I move around just without my crutches, and if I'm at church, I go to church. So if I'm at church within a closed space, I can move around without my crutches. But for long distances, like campus is pretty big, so moving around, I generally need um, my crutches to do so. Otherwise, my leg will get very hurt or in pain. So I try to avoid that. My leg is still a bit swollen, um, which is probably from the fact that I don't think I wore my leg brace and didn't ice it as long as I should have. My tubing that they give you at the hospital, they give you tubing to put over your leg. You can see it in my past videos, but I don't think I wore it as long as I should have. But my leg was getting really small, so the doctor told me to take it off. And then I didn't ice my leg as much as I should have as well, um, which are points for you to take. Listen to what the doctor says. As uncomfortable and irritating as it might be, just do what they say. You should get better faster that way. But yeah, I removed my stitches on Thursday. I'll just show you my knee now. Alright, so that there is my knee. Um, Still pretty swollen, but it's bending quite a bit now, which I'm happy about. Bending all the way. As compared to my other knee, which is over there. I don't know if you can see it. Let me just get down. I'll show you. So that's one knee. It's pretty swollen. This is my normal knee, but this one's still pretty swollen. Um, but yeah, I started doing the physiotherapy this week. So hopefully the strength in my knee is gonna come back. So what's happening is right now my knee is not hurting as much. It's hardly ever in pain, which is which is really good. But it's just that my hamstring muscle is my thigh muscles are so weak. There's for my left leg they're so weak. Like I'll be walking and my muscles still can't support the weight of my body, so my knee will buckle a bit. Not because the knee's weak, but because the leg muscle is weak. So I'm doing physiotherapy to strengthen that. Do it. It's painful, and it is quite irritating as well to do, and it's not nice to do, but do it. Push through it. The more you do it, the faster you will recover. So do that. What else? What else do you need to know? Yeah, just pretty much push through the exercises that you've been given. I was told to do mine twice a day, but that's a bit tough right now because we're in a pretty hectic period of school. So assignments are due, tests are coming up. It's just about the mid-semester part where things are getting pretty hectic. So it's hard for me to do it twice a day. So I do it in the evenings when I'm coming back from school, when I'm back from school. Um, Yeah, be on your crutches. Recovery time is differs from person to person. My leg, the girl I was watching from Canada, who I watched her video before I did the surgery, and by the second week she was walking okay. Um, she was off her crutches after the first few days, but it differs from people to people. Um, I also should let you know the type of surgery I did. I did a keyhole surgery, so that means they basically just took three. Let me just show you. So basically, they took three they made like 3 holes in my knee. Um, they cut up us. They cut open right there. They drilled through the bone right up to here. Then they had a hole for the instruments to go in and thread through the ACL. Then they also they cut part of my hamstring muscle from over here. And they pulled it, and that's what they used to thread through. And then they had another hole this side for the camera, right over here. Wait, second. So somewhere over here they had a hole for the camera that went through. So the camera went through here. There were 2 holes over here. I don't know if you can see them. And then there was where they drilled through was right over there. And then so they threaded through the ligament that they took from over here. They threaded it through. They pinned it over there. There's a metal in my leg now. It's kind of weird to feel, but it's over there. And then they tied it to the remaining part of the hamstring, the part that had been torn, somewhere over here. So yeah, that was the surgery. So my recovery took longer because it's taking longer because they used part of my hamstring. Another technique they do is they use the hamstring from a cadaver um, to do that, and I think that's what they did for the girl in Canada. So yeah, I think that's it. Let me know if you have any questions. Just leave it in the comment section, and I'll get back to you as soon as I can. I'll be checking now more frequently because I'm coming towards the end of the busy period. So I'll just be checking to see if anyone has any questions. I'll try and post a video to reply, or I'll reply in the comment section. All right, coolies. See you.